India will soon be able to carry out saliva-based testing for diagnosing COVID-19 patients if the government approves this form of specimen collection, which is considered to be safe for healthcare workers and also less discomforting for individuals. The researchers at the Medanta Institute of Health and Education have found that the saliva-based specimen collection is as accurate, in fact in some cases more accurate than the current form of the nasopharyngeal route of collecting samples for diagnosing COVID-19. These are early days, but there are several advantages of the saliva-based specimen collection. One of the biggest advantage is that it exposes the risk of infection for healthcare workers because the samples can be self-collected. An individual can self-collect the sample by either spitting in a container, or the samples can be collected through a tube method, which ensures that the healthcare workers are not directly in contact or come in contact with the infection. So this is one of the biggest advantages of this way of specimen collection. Also, in times, the researchers at Medanta that we spoke to say that they found that in this way of sample collection, the accuracy of the tests were much better than what it was through the nasopharyngeal route. Couple of things to remember is that this is not a rapid antigen test. That is, your results will not be out in 30 minutes time. And this is not a home-based test. That is, you can't do the testing at home. This form of specimen collection will be run through the current RT-PCR method, which is a gold standard for diagnosing COVID-19 patients. What it does is that is the method that's different. So instead of inserting a tool in your nose and throat, all an individual have to do is perhaps spit in a container. The US FDA has approved 5 such tests that uses saliva-based specimen to do the testing. In fact, it approved one by Yale University last week. And the US FDA thinks that this form of collecting samples protects healthcare workers more than anything else. So these are early days. The researchers are expected to publish their findings in a medical journal in a couple of weeks' time, and that would give an indication for the ICMR to take the next course of action, whether to approve this way of sample collection or not.